my name is Carl Cooper, and I'm the Project Manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability. And this is our presentation, Health Insurance Jeopardy, Part 3, Rehab and Habilitation Benefits. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say that when a consumer is looking at plans on the ACA marketplace, it's like playing a game of Health Insurance Jeopardy. And I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure that they're asking the right questions about plans being offered in order to make an informed choice. So let's go ahead and play our game. And today we're going to be looking at the category Rehab and Habilitation Benefits. And in this first scenario, you're meeting with an individual that has limited mobility but indicates that certain therapies have helped her maintain the mobility she does have. In this instance, you need to ask the question whether the Qualified Health Plan, or QHP, covers rehabilitation therapy. And if she tells you that she hasn't seen a physician for the condition in some time, then you need to ask the question whether the QHP requires pre-authorization for rehab therapies. Because many times the QHP, if they require the doctor to sign off before the person goes for the therapy, then this is an issue for continuity of care, and you need to make sure that the individual is continuing to receive the coverage that they need for that condition, and making sure that that continuity of care is not interrupted. If she says that she has to go repeatedly for it to have any lasting effects, then you need to ask the question, does the QHP put a limitation on the number of rehab visits? One of the things about the Affordable Care Act was it got rid of dollar limitations that insurance companies were allowed to put on various plans. So once you reached a certain dollar limit, you weren't allowed to receive any more benefits under that plan. They are not allowed to do that anymore under the Affordable Care Act, but what they can do is they can put service limitations on. So many times, especially for rehab therapy, it can be something where they will put a limit on the number of visits someone can have for a certain condition, or sometimes it's over a course of time. So over the course of the year, they're only allowed so many rehab visits, and that's obviously something you're going to want to look at if the person says that they have to go for it to repeatedly for it to have any lasting effect. This is commonly known as maintenance therapy, and many times health insurance companies are not fond of paying for what is referred to as maintenance therapy, because for rehab, they usually want to see that the person is getting better. And many times rehab for someone with a disability doesn't mean getting better, it just means maintaining what they have so that they can maintain an independent lifestyle. Let's go to a situation where a family has a child with developmental disabilities that affect their activities of daily living. And in this instance, you need to ask the question, does the QHP cover habilitation therapies? And for those of you unfamiliar with habilitation therapies, really just think of it as rehabilitation without the RE. And when it's rehab, it is commonly known that it's something that happened, that you lost something and now you're trying to gain it back. With habilitation therapy, it's basically taking that RE off. You're trying to get something that you've never had. So many times it's used in situations of someone with a developmental disability that allows them to become more independent by gaining some sort of life skill that they've never had. And habilitation therapies many times are treated differently by health insurance companies, and many times are not covered by health insurance companies. So you want to make sure that you're looking at exactly what is covered on these for habilitation therapies, if that is something that the individual needs. And if a family has a 4-year-old child who is nonverbal, a specific type of habilitation therapy would be speech therapy. So you want to ask the question, does the QHP cover speech therapies in this situation? Once again, an example of habilitation therapy where the child obviously has not been able to speak and they're trying to learn how to speak better, and that is something then that is not something that they're trying to gain that they've lost, but it's rather something that the person never had, and they're trying to gain that skill. So that is what habilitation therapy is. If you're interested in learning more about the NDNRC, you can check out our website at www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions. As you're assisting an individual with a disability enroll in health insurance, also, please make sure to subscribe to our YouTube channel to get more helpful videos like this one. And if you're interested in learning about the other categories that were listed, be sure to check out the links in the description below to access those videos. Thank you.